This is the Minnesota Department of Human Services Family Child Care Orientation. Module 3, Infant Safe Sleep. Infants and Sleep. In this module, you will learn more about caring for infants, including requirements for safe sleep. Are there special requirements for infant sleep? There is a high need for infant care in the state of Minnesota. There are special safe sleep requirements to think about when considering caring for infants. Having these additional requirements in place for infants has reduced the infant death rate in child care programs across the state. Infant sleep positioning. Minnesota Statutes, Section 245A.1435, Paragraph A. When a license holder is placing an infant to sleep, the license holder must place the infant on the infant's back, unless the license holder has documentation from the infant's physician, advanced practice registered nurse, or physician assistant directing an alternative sleeping position for the infant. The physician, advanced practice registered nurse, or physician assistant directive must be on a form approved by the commissioner and must remain on file at the licensed location. An infant who independently rolls onto its stomach after being placed to sleep on its back may be allowed to remain sleeping on its stomach if the infant is at least 6 months of age or the license holder has a signed statement from the parent indicating that the infant regularly rolls over at home. Overview of infant sleep positioning. Always place an infant to sleep on their back. If an infant younger than 6 months rolls over onto their stomach, the infant can remain sleeping in that position only with a signed statement from the parent. If a parent does not sign a form, you need to ensure that the infant remains on their back. An infant older than 6 months who independently rolls over on their own after being placed to sleep on their back may remain in that position to sleep. Infant cribs. Minnesota Statutes, Section 245A.1435, Paragraph B. The license holder must place the infant in a crib directly on a firm mattress with a fitted sheet that is appropriate to the mattress size, that fits tightly on the mattress, and overlaps the underside of the mattress so it cannot be dislodged by pulling on the corner of the sheet with reasonable effort. The license holder must not place anything in the crib with the infant except for the infant's pacifier, as defined in Code of Federal Regulations, Title 16, Part 1511. The requirements of this section apply to license holders serving infants younger than 1 year of age. You must sleep an infant in a crib, portable crib, or playpen. It must have a firm mattress with a fitted sheet that is appropriate to the mattress size. The sheet must fit tightly on the mattress and wrap around to the bottom of the mattress so it does not come off when pulling on the corner of the sheet with reasonable effort. The only item that can be placed in the crib with an infant is the infant's pacifier. Swaddling. Minnesota Statutes, Section 245A.1435, Paragraph D. Placing a swaddled infant down to sleep in a licensed setting is not recommended for an infant of any age and is prohibited for any infant who has begun to roll over independently. However, with the written consent of a parent or guardian according to this paragraph, a license holder may place the infant who has not yet begun to roll over on its own down to sleep in a one-piece sleeper equipped with an attached system that fastens securely only across the upper torso, with no constriction of the hips or legs, to create a swaddle. Prior to any use of swaddling for sleep by a provider licensed under this chapter, the license holder must obtain informed written consent for the use of swaddling from the parent or guardian of the infant on a form provided by the commissioner and prepared in partnership with the Minnesota Sudden Infant Death Center. Overview of swaddling. Swaddling an infant is not recommended. If you choose to swaddle an infant in your care, you must have written consent from the parent. An infant who rolls over on their own may not be swaddled. Any swaddle used in your program must meet licensing requirements. There are many swaddles and sleeper options available for infants. It is important to read and understand what licensing requirements do and don't allow when caring for infants. If you have questions about this topic, please contact your county's licensing unit. Checking on sleeping infants. Minnesota Statutes, Section 245A.1437, Subdivision 1. Paragraph A. License holders that serve infants are encouraged to monitor sleeping infants by conducting in-person checks on each infant in their care every 30 minutes. Paragraph B. Upon enrollment of an infant in a family child care program, the license holder is encouraged to conduct in-person checks on the sleeping infant every 15 minutes, during the first 4 months of care. Paragraph C. When an infant has an upper respiratory infection, the license holder is encouraged to conduct in-person checks on the sleeping infant every 15 minutes throughout the hours of sleep monitors. Minnesota Statutes, Section 245A.1437, Subdivision 2. In addition to conducting the in-person checks encouraged under Subdivision 1, license holders serving infants are encouraged to use and maintain an audio or visual monitoring device to monitor each sleeping infant in care during all hours of sleep. Overview of checking on sleeping infants. It is recommended that you check on each sleeping infant at least every 30 minutes. It is considered best practice to check on sleeping infants at least every 15 minutes, especially during their first 4 months of care and if the sleeping infant has an upper respiratory infection. Those conditions have been proven to increase the risk of sudden unexplained infant death. The use of audio or visual monitoring device to monitor sleeping infants is encouraged, but not required. They do not replace the need to check on sleeping infants yourself.